Just about.
Thank
Thanks
you
a lot.
very much.
All right.
Many pregnant women experience different aches and pains, but there's a way to stop foot and low back pain from even starting. Patrick Myers and Aaron Rabel-Wilson from APES Physical Therapy join us now. Good morning.
Good morning.
Good morning. Patrick, first tell us why so many women have low back pain from pregnancy.
Well, obviously there are a lot of changes in the physical structure as the pregnancy evolves. And as we talked about in last month's segment with spinal structure and neck and headache pain, the pain can be addressed in pregnancy as well in a few simple visits with your physical therapist. The low back here, the lumbar spine, which are these 5 lower segments, have a slight curve to them, and then obviously the pelvis comes together and is held together by these structures here. A lot of ligamentous structure, a lot of joint structure. That all starts to change with the hormones that are introduced in pregnancy.
And Aaron, you actually are 7 months pregnant. Congratulations.
Thank you very much.
Tell us about some of the exercises pregnant women like you and others can do to prevent some of this pain.
That's a good question. One of the things that we wanted to show on our model is that during pregnancy we have the hormone relaxin, and it loosens our joints and readies us for labor and delivery. But we need to kind of strengthen the muscles that hold the joints together. So some of the things that we can do in physical therapy is use a belt, or actually that would support and stabilize what the muscles would do. So we're going to demonstrate a couple of exercises. We brought a ball in here today. I'm going to get up here and have a seat on the ball and show how you can still pull in the muscles around the pelvis to stabilize. And then once we've got those pulled in, then we can put an exercise on top of that, as in just leaning back really strengthens these muscles. So sitting on a ball is a great way to do it, or you can sit on your couch at home.
How about crutches? I know some women still do the crutches on the exercise ball during pregnancy. Is that safe?
It's actually been proven safe and effective for reducing pregnancy pain and post-pregnancy pain. So what you would want to do, though, is make sure that you're pulling in with the muscles instead of trying to push out or really bulge out. It's already bulging out, so we want to pull it in and stabilize.
And it also will help during labor.
That's correct. Exercise has been shown to decrease labor time by 2 hours and decrease the use of forceps and vacuum with delivery.
Can you demonstrate how the belt works?
Yes, I can. We want to keep the pelvis together, so we put the belt around the pelvic joints like this, and then pull forward, and then it just kind of reinforces what our muscles are supposed to be doing.
And I know some people there's certain kind of belts that some women wear all the time during pregnancy just because it relieves some of the back pain. Is that
This is another belt that we brought with us today, and it kind of goes a little bit lower, and it's a bit wider in the back, so it gives a much more support for those joints of the back as well.
And when would you need that? Probably last trimester?
It just depends on your current fitness level. Some people need it throughout, and some people just may need it for a short amount of time. The most important thing is to get if you have back pain, to get evaluated by a physical therapist who can then use a simple technique by using your own muscles to put you into a better alignment, and then we would use the belt to stabilize you, hold you there, and then exercises to help reinforce that.
Well, thank you both for coming in this morning.
You're welcome. Thanks for having us.